Hello guys, today I am starting a very important topic in anatomy, first year Mbbs. Cranial nerve, cranial nerves, nuclei. Okay. First, first we'll discuss about the pharyngeal arches. There are five. There are five pharyngeal arches. Pharyngeal arches. 1, 2, 3, 4, and 6. Dharam. First stress is supplied by the mandibular nerve. 8, 9, and these both are supplied by the 10th nerve. Okay, 10th is vagus. So 8 this is facial. 9th, and this both supplies the muscles of pharynx and larynx. This is supplies muscles of mastication such as mastication. Now let us discuss about the extraocular muscles. Extraocular muscles, they're derived from somatomeres. We can know that extraocular muscles are derived from somatomeres, and the tongue muscles are derived from somites. This we will learn in general embryology. Now let us see a diagram of the neural tube. It's a very important topic, the neural tube. Very important topic. Neural tube ऐसा दिखता है. So ऐसा. This is the diagram neural tube. This is the alar plate.
Center of curvature से जो
Alar pens. This is a sulcus limitans, and this part is known as basal plate. Alar plate, basal plate. Okay, this is the neural tube. We are discussing on neural tube. This is alar plate, this is sulcus limitans, this is basal plate. Okay, please learn the pharyngeal arches properly. There are 5 pharyngeal arches. Now a detailed diagram. Now this thing opens up like this, and this thing opens up like this. It opens up like this, and let us use a black light. This ऐसा रहता है. This is the 4th ventricle. This now I am discussing some nuclei. Here 3 and here 4. Dorsal column nuclei. It is GSE. It is SVE. GSE means general somatic efferent. SV is special visceral efferent. It is GVE, general visceral efferent. Another 4. 1, 2, 3, 4. अब क्या हो सकते हैं? जनरल G लिखो, S लिखो, फिर G लिखो, फिर S लिखो. Visceral efferent, visceral efferent, somatic efferent. These are the nuclei in the neural tube, and these are very important nuclei. Okay, these are very important nuclei in the neural tube.
hello.
Now let us discuss a detail about this GSE, general somatic efferent. This supplies the muscles of extraocular muscles and the tongue. As you all know, the extraocular muscles and the tongue. Now discussing 7 special visceral efferent. This supplies the muscles of pharyngeal arches. Just learn it. Afterwards we'll discuss a detail about it. Now after this we get general visceral efferent. The third nucleus. This is general visceral efferent, and it supplies the smooth muscles and glands. Now Special visceral afferent.
भैया देखो साउंड
Special visceral afferent. First, let us. After this, we have general visceral afferent. General visceral afferent supplies.
जगदीश
अरे, general visceral afferent means the muscles from the viscera. It supplies the muscles from the viscera. So muscles from the viscera. Muscles from viscera. And इसके बाद क्या था? Special visceral afferent. Special visceral afferent. It supplies the muscles of taste. And GSA, general somatic afferent, general sensations from body, general sensations from body. And spatial somatic afferent. Spatial somatic afferent has a multiple functions. It has multiple functions. It is in olfaction, vision, hearing, balancing, 8th nerve. Vision is first and second nerve. Vestibular nucleus, cochlear nucleus. Okay. Now I will draw you a chart which is a very important chart. Very important chart. Everyone must draw it. Here we like midbrain, pons, medulla oblongata, GSC. Then what you have done? General is SVE. Then we get GVE. Then after that we get GVA, general visceral afferent, or it's same as special visceral afferent. Then we get general somatic afferent. Then we get general then we get special somatic afferent. Remember the nerves that are supplied by this is third, right here fourth, here sixth, 3, 4, 6, 12, 3, 4, 6 and 12. And this V3, 8, 9, 10, 11. And this is Edinger-Westphal nucleus, superior salivatory nucleus, inferior salivatory nucleus, and dorsal nucleus of vagus. And these three are combinedly called as nucleus ambiguous, nucleus ambiguous.
Okay.
This is known as nucleus tractus solitarius. This is the great trigeminal nucleus. We are drawing it big. I will discuss it in detail. What are its parts? This is a great trigeminal nucleus, and it is the pontomedullary junction. Pons and medulla. The junction between the pons and medulla is known as pontomedullary junction. Now let's discuss something. What will happen when there is a injury to the nucleus ambiguous. Injury to the nucleus ambiguous. Injury to the nucleus ambiguous. What will happen to the injury to the nucleus ambiguous? These 3, 4, 6, 12, and V3 it's a mandibular, 8, 9, 10, 11, Edinger-Westphal, फिर सुपीरियर सैलिवेटरी न्यूक्लियस, इन्फीरियर सैलिवेटरी न्यूक्लियस एंड डॉर्सल न्यूक्लियस ऑफ वेगस. अगर ये डैमेज होगी क्या होगा? पहली बात, इप्सिलैटरल बल्बार पैरालिसिस. टंग को कुछ नहीं होगा, बस टंग को कुछ नहीं होगा, बट इप्सिलैटरल बल्बार पैरालिसिस एंड लॉस ऑफ गैग रिफ्लेक्स. It is caused by the 9th and 10th nerve. Loss of gag reflex. Please remember it. Now let us discuss special about the general visceral efferent column. Let us discuss it more in more detail. The Edinger-Westphal nucleus through the third nerve. It supplies the sphincter pupillae and ciliaris. Sphincter pupillae and ciliaris muscles. The superior salivatory nucleus through the eighth nerve through the eighth nerve supplies the submandibular, sublingual and lacrimal.
ये समझ आया क्या मैंने सोचा नहीं
Edinger-Westphal nucleus. Third, inferior salivatory nucleus. Which muscle it can support? It supports the parotid gland through the ninth nucleus, parotid. Dorsal nucleus of vagus. Vagus is 10th nerve, so I am giving it 10. This 10. Through the 10th nerve, it supplies the smooth muscles of thorax and abdomen. Okay, muscles of thorax and abdomen. So we know that the parasympathetic nerves are these four. Which one? 3, 7, 9 and 10. 3, 7, 9 and 10. 3, 7, 9 and 10. And parasympathetic is general visceral efferent column. It is general visceral efferent column. हमेशा याद रखना. General visceral efferent is parasympathetic. And thoracolumbar outflow is sympathetic outflow. Now we'll discuss about the trigeminal nerve. I've told you we'll discuss in detail about the trigeminal nucleus. This part is known as mesencephalic nucleus. This is the principal nucleus or chief. It's called the principal or chief nucleus. Principal nucleus mainly किसके लिए होता है? टच एंड प्रेशर के लिए. टच एंड प्रेशर. इट इज़ द स्पाइनल न्यूक्लियस. ठीक, अब इसका काम देखते हैं.
जगदीश.
इट इज़ फॉर प्रोप्रियोसेप्शन. Principal nucleus, it is for touch and pressure, and it is for pain and temperature. ये 3 पार्ट. तो आज के लिए इतना ही. Tomorrow I will discuss about the cranial nerves. 3, 4 and 6th cranial nerve, their outflow and which muscles they supply, and also the injury.